I'm Christine Chomienne. I'm Professor Emeritus from the University of Paris, France, in CERN, but I'm also the Vice Chair of Horizon Europe Cancer Mission Board. Well, it's the topic that everybody sees now is the word implementation. It's the major challenge. I think in the last 10 years, brought so many good ideas to be able to fight cancer and to bring excellent care and support for the patients, for their carers throughout Europe. But these ideas have difficulty in being implemented at the member states level, at the regional level, and at the local level. So the challenge is getting the people who are necessary to implement the actions to actually commit and to be able to deliver the changes to the citizens. And for me, the major problem I see is that it's changing the way people have been used to work, the policymakers, the authorities. And it's difficult for them to have the workforce, the dedicated time to be able to see what is necessary to change. What do they have to lobby with their presidents at the member states level so that change and funding is provided? And for that, I think they need evidence. We need to provide the policymakers with the evidence that our actions are going to change something. Otherwise, they will not have the power to be able to convince their authorities that they need to change the way they are working now to be able to make a difference to our fight against cancer and the care that we provide to the patients and the carers. So the actions seem simple. For me, the actions is to bring the people to sit around the table. So that's what the European Alliance of Personalized Medicine always do, bring stakeholders together. That's what the EU opportunities, the Beating Cancer Plan, the Cancer Mission, they bring huge consortia together to be able to exchange and to talk. The difficulty is once you get the people together, which is one success, you have to make sure that the people who are sitting in the room actually are listening, actually are understanding and willing to change and to implement what the discussion of the day has brought forward. So for me, the action is yes, to bring the people together. It's communicating, but also communicating with the right messages and the right evidence that fits the people that you want to convince. If you want to convince a researcher, you come with a graph, with a nice curve, statistical evidence. If you want to convince a policymaker, you have to bring sometimes economic data. You have to bring success. You have to bring examples. And this is something that our cancer field has not really been successful in doing. We are not used to bring the right evidence and the right words to the policymakers. And so we have to change that. It's an action which I think is important. The second one is involving patients, citizens, and carers. It's difficult to convince a policymaker that you are going to change the way things are doing for the benefit of patients or citizens if you do not have also the understanding and involvement of patients and citizens. They need to be able to say that what you are doing is exactly what they need. And they believe that what you are going to do is really going to change their life expectancy, their quality of life, and reassure each citizen that the change is going to be worthwhile. So working with patients and citizens, sitting down and really understanding their needs so that the actions are adapted to their needs. I always have researchers who sometimes say you cannot have citizens and patients dictating the way the researcher and the evidence is being brought. But it's a question of working together for the same goal, and working with citizens allows to provide the sentences that the researchers do not know how to use so that it fits the needs of the citizens. And I believe that the sentences that the citizens understand is the same sentences that the policymaker understands. So for me, the two actions is to bring together stakeholders that we have never brought together, policymakers and citizens, and we have as a community of medical sciences and researchers to be able to adapt to their way of working, to their way of doing evidence, so that we can work in the implementation. I think the suggestion, and you're right, citizens, people do not want to hear the word cancer. And so if you want to involve citizens, it's better to provide a more open goal of improving your health, have a healthier lifestyle. Most of our risk factors for cancer, our risk factor for the survivors with cancer, are general lifestyle habit of improvement. No tobacco, not too much alcohol, be careful to what you eat, exercise more. These are changes and habits that you have to provide in your usual life, and this is really linked to all types of diseases. And I think it's better to involve citizens in understanding better how you can prevent disease and not automatically say it's to prevent cancer. We had, for COVID crisis, the need to explain to patients and to citizens, why you need to vaccine. It's the same messages for citizens. Why do you need to have vaccination for HPV? Why you need to have screening? It's the same type of messages. It's to be able to make sure that the citizens understand that they need to take into their own, let's say, activity and responsibility to make their life healthier. So I think it's the best way for reaching out to citizens. And then you have all the other citizens, and there are numerous now, who are citizens who know somebody who has cancer, whether it's in the family, a friend, or whether it's even in the workplace. You're a human resource department officer, and you are faced with somebody who wants to come back to work who has cancer, and so all these citizens are part and aware of the cancer patient and the cancer world, and so I think we can contact them also. I think it's something that I've learned working with patient advocacy groups. I remembered when I was president of the European Hematology Association, having patient advocacy groups sitting around the table for the first time. And there were 3 groups of chronic myeloid leukemia association of patients. And they said, oh, we're 3, so we have to be 1. And in the European Hematology Association, I had more than 1 scientific committee working on CML, right? So what I've learned from patient advocacy is that they've understood that getting together, coalition is maybe a name or whatever, but bringing together all the patients together in one group, in one voice, I think has much more impact than a different individual association. It doesn't mean that to reach out to a specific disease, to a specific group, you do need to have a dedicated patient advocacy group, but there also needs to be an enormous group coalition, because the goals, the work, the guidelines, the recommendations, the success stories, the identification of gaps are the same for everyone. And once again, patients do say that they find that a lot of work and good ideas are wasted because they are not brought together. So a coalition is a good solution.